This is what is known as an augmentation rhinoplasty. That is, we're trying to make the nose bigger. Now, to make the nose bigger, we obviously need to add material, and that material is cartilage. The most common place where we take cartilage is using rib cartilage for rhinoplasty. What is it? Why is it needed? Is it safe? Can you do all your activities afterwards? These are some of the most common questions asked to us by our rhinoplasty patients. And to answer all this and more, I'm Dr. Aniketh Venkataram, plastic surgeon at Ava Aesthetics. Now, to understand why and how we use rib cartilage, let us first understand what is cartilage. Cartilage is a material in the body that is firm but not hard. So in your nose, if you feel the top part is fully hard, it is made out of bone. The lower part, it is firm, but it is still a little movable. It is not bony hard. This is what is cartilage. And there are very few places in the body where there is cartilage. The nose is one place, the ear is made out of cartilage, and there is cartilage on the inside of your ribs. The outside of your ribs is bone, the inside of your ribs is cartilage. There are a few other places like in your spine and stuff, but these are the main places in the body where cartilage is present. Now, why do we need this cartilage? When we do cosmetic rhinoplasty, we are making changes to the bone and to the cartilage. So, we can reduce it to make a big nose smaller. We can move it side to side to change the shape of it. Or if we need to add it if we want to make the nose bigger. And it's in this third setting of adding cartilage which is where we might need to take rib cartilage. So this is what is known as an augmentation rhinoplasty. That is, we're trying to make the nose bigger. Now, to make the nose bigger, we obviously need to add material, and that material is cartilage. The most common place where we take cartilage is from the inside the nose itself. While doing rhinoplasty, from the central part called the septum, we remove a piece of cartilage, and we do that for all our cosmetic corrections. This happens in almost every rhinoplasty. But when we need to raise the height, the amount of cartilage we get from inside the nose might not be enough, which is when we look to take cartilages from other places. This can be either the ear or it can be the rib. The ear will give you a small amount of cartilage, but if you need to make the nose much bigger, that is when we need to take cartilage from the rib. The other place where this rib cartilage might be necessary, apart from an augmentation rhinoplasty, is in a secondary or a revision rhinoplasty. This is where one rhinoplasty has already happened, so the septal cartilage is already used up. So you need new cartilage to replace that, plus you need to give the nose its strength back. And this is where again we take rib cartilage. Now, are there any alternatives? Can we use anything else? Well, the only real alternative is to use artificial material. This is in the form of implants. Implants that can either be made of silicone or other materials such as Medpore. Now, I personally don't like using these implants, and a lot of other rhinoplasty surgeons don't. This is because these implants are never completely stable. There are other parts of the body like the breast where implants do well, but for some reason implants in the nose don't seem to do well. They can have complications even 5 years, 10 years, 15 years after the surgery. Cartilage that we use is your own body material, so it is much more stable. Once it settles down, you know it's not going to affect you later in life. Believe me, using an implant is easier. I wish they worked. It would make my job simpler. But because they don't, we have to do the more difficult job of taking the rib cartilage. Many surgeons who aren't confident of taking rib cartilage try to use these implants, and that is when things can go wrong. So, how is rib cartilage taken? To know how the rhinoplasty itself is done, you can see our other videos on this topic. But today we will talk just about rib cartilage. So here we make a small cut of around 1 inch. This is done in the groove below the breast or below the pec muscle in ven. So because we hide it in that groove, it is hardly visible. It is made roughly in this area. We typically take rib cartilage from the right side. And so through this incision, we go down to the rib and we take a piece of the cartilage. Typically, we don't take an entire width of a rib. So when there is a rib, we take one part of it. So there is still some rib left over that is in continuity. Once this cartilage is removed, it is cut up and used to make our cosmetic modifications. Now, are there any side effects of this? Can this cause any problems? Well, firstly, there will be a scar that is around 1 inch long, but as I said, that fades with time. there will be a little bit of pain in the post-operative period. For a week to 10 days, there will be some pain here, especially when you cough or when you try to lift something heavy, things like that. But ultimately, once this heals, you will not have any pain or restriction to your daily activities. Take a look at this person. He is a patient in whom we use rib cartilage. He is actually a bodybuilder and a gym trainer. We use rib cartilage for him, and he is able to go back to bodybuilding and gym training without any restrictions. So, when done correctly, this does not have any long-term side effects or any issues. Let us now see some results of patients in whom we used rib cartilage. So, what's the bottom line? The bottom line is we don't need rib cartilage in every single patient, but when we do need it, it is important that we use it rather than trying to do a shortcut and not take it. If you do it in that situation and you end up not taking rib cartilage when you do need it, the result that you give will be underwhelming. It won't be very impressive, and you might feel like you have simply undergone this surgery without getting the result that you wanted. So, to know whether you need it or not, go to a surgeon who is experienced in this. Someone who does rib cartilage rhinoplasty when necessary. Someone who doesn't do it, who is not confident in it, will tell you that it is not necessary. But someone who is capable of doing can really judge and say whether this is needed or not, and can give you unbiased information. If you have any questions on this, do write to us. Do like, share, and subscribe. Comment in the comments about what you think about rib cartilage rhinoplasty. Thank you. Have a great day.